Hello folks, welcome back. My name is Kweku and I'm a pharmacist. Today I'm briefly going to be reviewing the medication Jardiance. We're going to take a brief look at what it is or how it works. We will take a look at some side effects and some best practices or some counseling points. I would also give you some tips as to how you can get your Jardiance for free if you are in the United States and if you have insurance. So stay tuned for that. Before we delve any deeper though, just FYI, this video is for informational purposes only and is not intended to be a substitute for medical advice from your physician. So Jardiance belongs to a class of medications commonly referred to as SGLT2 inhibitors, sodium glucose cotransport 2 inhibitors. It is approved in the treatment of type 2 diabetes, obviously alongside with diet and exercise, and also to reduce the risk of cardiovascular death in adult patients with type 2 diabetes and who have an established cardiovascular disease. Jardiance works by blocking the reabsorption of glucose by the kidney. So ordinarily, when the kidney is working in the formation of urine, there are certain things that the kidney deems necessary for the body, and therefore the kidney reabsorbs them back into the bloodstream or into the body. One of such substances is glucose. But you would agree with me that anybody who is diabetic obviously is dealing with high levels of glucose in the bloodstream to begin with. So what Jardiance does is that it blocks the mechanism that allows the kidney to reabsorb glucose back into the bloodstream. The result is that there is an increased urinary excretion of glucose. Or to put it in very simple terms, you are urinating excess glucose. This ultimately leads to a better glycemic or glucose control for somebody who is diabetic and is taking Jardiance. Dosing typically starts at 10 milligrams once daily, generally recommended to be taken in the morning with or without food, and may be increased to 25 milligrams daily for those that require additional glycemic control. Some of the common side effects include hypoglycemia, which is when the blood sugar levels drop too low, and this was observed in about 0.4% of the population if they were taking Jardiance alone, that is on monotherapy. However, if they were combining the Jardiance with something else, say maybe a metformin or insulin or any other anti-diabetic medication, that percentage ranged anywhere between 1.2% to 28.4%, which is quite significant. So that is definitely something to watch out for if you're on combination therapy with Jardiance. Increased frequency of urination occurring in about 3.2% to 3.4% of the population has also been reported. And this is just because of the way the medication works. As I explained earlier, it causes you to urinate more glucose. It also actually increases urine volume. So if urine volume increases, then obviously the frequency of urination also increases. Jardiance has also been associated with urinary tract infections, occurring in about 7.6% to 9.3% if you take a look at all the patients, the overall population. However, for people 75 years and older, that percentage increased significantly to 15.1% to 15.7%. So basically, older people or people who are older than 75 years are more likely to develop urinary tract infections if they take Jardiance. Female genital infections have also been reported in about 5.4% to 6.4% of the population. Some other side effects that have been reported include nausea, hypercholesterolemia, which is an increase in your cholesterol levels, dehydration, polydipsia, which is an increase in thirst. You always feel thirsty. It's also been associated with arthralgia, which is basically joint pains. Now, some of the less common but potentially very serious side effects include diabetic ketoacidosis, which is basically a buildup of ketones up to dangerous levels in your body. For this reason, Jardiance is neither approved nor recommended for type 1 diabetics, just because type 1 diabetics have a greater probability or risk of developing ketoacidosis. Signs of ketoacidosis that one should look out for include symptoms such as difficulty breathing, nausea, vomiting, abdominal pain, confusion, and sometimes an unusual fatigue or sleepiness. So we'll now take a look at some precautions and some warnings. The first one, and probably the most important one, is a condition called necrotizing fasciitis, or sometimes referred to as Fournier's gangrene. So Jardiance and other medications in that class have been associated with a serious but thankfully very rare condition called necrotizing fasciitis. In very simple terms, necrotizing fasciitis just means flesh-eating disease. Like I mentioned, it's quite rare. In 2018, the FDA announced that over 5 years, 12 cases of Fournier's gangrene had been identified in patients taking not only Jardiance, but the medications in that class. That is a relatively small number, but obviously you don't want to be in that number. So the recommendation is that anytime there is any feeling of tenderness, swelling in the genital or perineal area, if there's any fever or malaise while you're taking Jardiance or any other medication in that class, you need to seek medical attention immediately. Typically, they will discontinue Jardiance in those circumstances and start a course of antibiotics and some other procedures to treat the condition. Jardiance should also be used in extreme caution, if even at all, with people with kidney disease. This is because Jardiance has been known or been reported to cause acute kidney injury and sometimes renal impairment in people who were already predisposed or at a relatively higher risk of developing that in the first place. So typically your doctor will check some of your kidney numbers, your creatinine clearance, your glomerular filtration rate or GFR to make sure that they fall within the ranges that is acceptable to take Jardiance. Now some savings info. If you are watching this in the US and you have insurance, the manufacturer is offering a zero copay offer where you can print a coupon and get your medication pretty much for free as long as it is covered by your primary insurance and you meet all the requirements as put forth by the manufacturer. So I'll be putting a link in the description. You can check it out and see if it will work for you. This is current as of the time of recording this video. On the whole, Jardiance is a relatively good medication if you check all the boxes that makes it appropriate for you, such as having a good kidney function. It's been noted to significantly reduce A1C in some people that take it, and also due to its heart protective functions, it makes it a very good medication for people who have diabetes and have a history of cardiac diseases. So there you have it, folks. I hope you found this review useful. If you did, please give it a thumbs up, share with anybody else who you think may find it useful. If you have any questions, leave them in the comments. I plan on doing a frequently asked questions on each of the medications that I review, so it'll be helpful to know what your questions are. Thank you so much. If you haven't subscribed, please do activate notifications so that you know when I release new content. Thank you so much, and I'll catch you on the next one.